this Ramadan.
Assalamu alaikum. Welcome back to News and Views on Salam Media with Aisha Kaji, your guest host for today. This segment is going to focus specifically on healthcare in Palestine. And I'm delighted to welcome into the studio my two guests, Dr. Khaled Dawas, a Palestinian British surgeon working in London, who is also chairman of the UK registered medical education charity. Dr. Khalid has recently been in Gaza, spent some time there, and is intending to go back very soon. He's going to talk to us, take us through how the devastation of healthcare facilities, infrastructure, and healthcare personnel in Gaza has really been such an integral, targeted part of this genocide. And then, on a slightly more positive note, we're going to be talking to Dr. Nufuz Maslamani, director of Dunya Women's Cancer Clinic in Ramallah. And she's the person who helped establish the first clinic of the sort for women's gynecological and healthcare in the West Bank. The first time that women in the West Bank have had access to, for example, breast screening, given that women in Palestine, one of the leading causes of death of women in Palestine is breast cancer. With that, I'd like to welcome you both. Assalamu alaikum wa rahmatullahi wa barakatuh. And without any further ado, I'd like to actually go to you, Dr. Khalid, to essentially explain to us what's really happening on the ground in terms of healthcare in Gaza.
Wa alaikum assalam wa rahmatullah, Aisha. Thank you for hosting me. So I went to Gaza over Christmas and New Year a few months ago, and inshallah I'll be going back in a few weeks. And what you notice on the healthcare side, first of all, you have a background. I went in there with a background of what was going on. I have a lot of contacts amongst the doctors and healthcare workers in Gaza particularly, but also in Palestine generally. And we worked in a hospital called Shuhada al-Aqsa, which is in Deir al-Balah, which is in the center of the Gaza Strip. And at that point, a lot of the people had been displaced from north part of Gaza Strip, so from Gaza City down to that central governorate, and then further south into Rafah. So we focused in the area in the middle. We were working in the main hospital that provided care for some of the refugee camps in the center. You might have heard of Brej, you might have heard of Maghazi, Nusayrat, and these were the center of the fighting at that time, and they remain to be so. And what we saw was a hospital that was completely overwhelmed by the volume of patients that was coming in, the vast majority of whom were trauma patients. But then we can't forget the fact that that also means that patients who have chronic diseases, patients who have illnesses like cancer, like diabetes, patients who have gangrene in their limbs because of diabetes and blood diseases, weren't getting any care. So a hospital which had a bed capacity of 100 now had a capacity of 700, or rather volume of patients of 700, mainly on the floor in between beds. There was no space to walk. The conditions in terms of infection control were awful. There was no antibiotic availability. There were no painkillers available. So it was really quite a devastating thing to see. And bearing in mind, this is the only hospital that served probably a population of at least 500,000. And then we can talk about what's happening in Khan Yunis, about the hospitals available there. There are really only probably 2, maximum 3 functioning hospitals at the moment. And out of those, probably only one, which is the European General Hospital in Khan Yunis, which is doing enough, not rather enough, but rather has enough capacity to deal with what's going on at the moment in its surrounding area.
So that sounds like a truly horrific situation. In terms of, this, what I was talking about earlier, these images that bombard us on daily basis, particularly of children, with limbs amputated, etc. And one can't but help wonder what the future of these young people is going to be, not only because of the physical damage they've sustained, but also because there's now been the creation of a generation of children who, God forbid, but probably are going to be growing up traumatized into an entire generation that's traumatized. So there are mental health implications here as well as the actual physical health implications, are there not?
No doubt. I met several people in Gaza and in outside Gaza as we were traveling towards Gaza, and they will all freely admit to you that they all need years of therapy for what they've seen. So on the psychological front, these are the people who are adults who have left. The children there, yes, I mean, Gaza in general is very resilient, and I've been to Gaza several times pre this war, and the people there are very resilient. But what you do notice, even in normal, let's say, inverted commas times, is that there's a lot of underlying anxiety, there's a lot of underlying mental health, because they lived in a siege. They were besieged for the last 17 years.
Mm-hmm.
So there's no such thing as normal in Gaza anyway before 2023. And
Yeah,
the
I
sorry, go ahead.
sorry, go ahead. Go ahead.
Now, I was just going to add that I think on the physical side, what the pictures that we see on TV, I saw in person, and they're extremely real. You see the numbers of people coming into hospital each day, and the vast majority of them are children. There's a picture that sticks in my mind very clearly from, in fact, New Year's Day this year, where we had 3 children lying on the floor in the resuscitation department because there are no beds. And out of these 3 children, 2 of them were dead. 2 of them were dead because they had not just injuries in their chests and their abdomens, but they had shrapnel going through their skulls. And
Goodness.
and I think it's really impossible to contextualize that and to be able to understand how this is acceptable to anybody, how those who can change something about this aren't not doing anything about it.
Mm-hmm. Yeah, that's a terrible image you've planted in our heads, but a necessary one, I think, Dr. Khaled. Thank you for that. Going to you, Sister Nufuz, Dr. Nufuz Maslamani in Ramallah. As I said, you are the director of the Dunya Clinic. It's the first facility of its kind to offer these services to Palestinian women, especially considering the high rate of breast cancer in among Palestinian women. So welcome to you. Can you tell us a little bit about your work and the kinds of patients you're seeing on a daily basis?
Good morning. Good morning, Dr. Khaled. Thank you for hosting me, and many thanks to the people and the leadership of South Africa. We highly appreciate your role in supporting the Palestinian cause to achieve human rights, freedom, and independence. First, before talking about Dunya Center, I want to talk a little bit about the breast cancer. Breast cancer is the most common cause among women in Palestine, and breast cancer is the first cause of death for women from cancers, and the third cause of death among other cancer. Breast cancer is fear, is a stigma, is very difficult. So because of that, in 2011, because of that, and due to the lack of diagnostic services in West Bank for early detection of breast cancer, because we know that with early detection, we can increase the survival rate more than 90%. So, Dunya, because of the difficult political, social, economic conditions which we live in, we established Dunya in 2011, which has a comprehensive and multidisciplinary team in both of diagnosis process and in the preparing of treatment plan according to the international standard. Dunya offer all the diagnostic services for breast and gynecological cancer, starting from how to teach the woman to do self-exam, mammogram, ultrasound, biopsy, wire localization when we put a layer or breast marker. Most of these services not available in that time, maybe after also 6-7 years after we established Dunya. Dunya also offer different services, such complementary services such as psychological support and physiotherapy, because after lumpectomy and mastectomy, to improve the quality of life of women and their family. In 2018, we have also the mobile clinic, which worked in, which visited 122 villages and we diagnosed in this time 54 ladies with breast cancer. This
Wow.
woman in these villages, they will never thought to be to go to do screening if the pink clinic didn't visit them. So it means that it is early detection and we save their life. Their life. We have a lot of, also by for gynecological service, we newly add services such as screening for HPV, for colposcopy, hysteroscopy, pap smear, because we know and we believe that early detection can save the life.
Absolutely. It sounds like you're doing sterling work there, Dr. Nufuz, particularly with the mobile clinic, with the screening, etc. Tell me, I know that the ease of access in the West Bank is quite difficult, getting from one place to another. I've experienced those checkpoints myself, and I'm sure the mobile clinic has done a lot to actually ensure that more people get access to your services.
You know that everything is very difficult in Palestine, in West Bank. Dr. Khaled talk about Gaza, and you know everything about Gaza. We are very sad about what happening, but in Palestine, for example, the mobile clinic, many times the checkpoint, they stop the mobile and they refuse to allow them to enter the go again. This
We
is
seem to have.
yes, this difficulty is happened. This is one of the difficulty. Also, the women have to take. We don't some diagnostic machines such as PET scan not available in West Bank, and to go to Jerusalem, the woman has to go to Jerusalem. They have to pass the checkpoint, and they have to take permission from occupation authority, and sometimes they refuse to give them this permission. Many difficulty. Also, financial situation for the people very bad. So this our mobile clinic now for 1 year is not working because we don't have money to continue, because it's the mobile clinic we offer the services free of charge, because it's go to the marginalized area. We are in Dunya, non-for-profit organization. In Dunya, we take fees from people, but it covers 45% of our need. But in the mobile clinic, free of charge. This is,
Right.
yeah.
Sorry,
Yes.
that sounds like you're, as I said, doing absolutely sterling work there, and very much needed work. And I certainly hope that viewers and listeners listening to this perhaps might be motivated to help you get that mobile clinic up and running again, inshallah, or that somebody comes forward to help with that, because it sounds like it does some really remarkable work. Having said that, thank you so much for giving us that snapshot into the work that Dunya does and into healthcare more generally in the West Bank and East Jerusalem areas of occupied Palestine. Back to you, Dr. Khaled. We don't have too much time left, so I just want to ask you for some final thoughts from you as to what we can do here in South Africa in solidarity with what's going on in Gaza. I know that organizations such as Gift of the Givers have equipped mobile clinics to come into Gaza, for example. But of course, that aid has all been stopped at the border. And you're going back. What's your aim in going back, and what can we do to assist? Really, that's my question.
I think the whole world has stood up, Aisha, and noticed what South Africa has done for Palestine, for Gaza specifically, but generally actually for humanity. South Africa has set the standard for what should be done in this kind of situation. And I would advocate that what South Africa has done as a government and as a people is probably the model that we should follow. You're right that we all have a duty to help, to donate, Ramadan is here. The zakat that we maybe should think about, we should think about where we would like it to go. And I would urge people to consider Palestine, as I'm sure many people are.
Mm-hmm.
But ultimately, like you say, the aid that's going to Gaza goes through a system where it goes through Egypt and then gets to a checkpoint in Israel and is stopped. Many of it is stopped by the Israelis and is turned back. And I saw that myself. I saw the trucks being turned
Mm-hmm.
back, and trucks full of nappies, diapers, as an example. I think the pressure on the Israeli government and on the Israelis that support that government to change the course of what is happening is important, and it's not to bring it back to what it was on October the 6th, but rather to put pressure on Israel to make it realize that its continued occupation, not just of Gaza, but the West Bank, has to come at a price to the Israeli government. And
Mm-hmm.
therefore, I think I would urge that pressure that comes primarily from South Africa at the moment should be made even stronger, and we should go down that route. At the same time, we have a duty as humans to help the people in Gaza and to make sure that when aid can get in, it does get in and it's enough volume, and that when the day after the war is over, that we are all ready to do something to make their lives a lot easier than they currently are.
Absolutely. Thank you so much for that, Dr. Khaled. Dr. Nufuz, any last words from you? We're running a little bit late and our next guest is already on standby. So just a final comment from you, please.
I want to say that our situation will not be changed unless the occupation is stopped. We need our freedom. We want to live in like all the people. We want all of our all our right to be. We want now, please, if to make pressure on Israel to stop the war on Gaza. Israel destroy everything they can destroy, but I know that they will not destroy our strength, and they will not destroy our our will and determination to live in dignity and freedom. Thank you very much, and thank for all the people and the President of South Africa.
Thank you so much, Dr. Nufuz, Dr. Khaled. You heard it right here. The Palestinian people deserve the right to live with dignity and freedom. The Gazan people need our help right now. So do the others in Palestine. Think about where you want to put your zakah. Thank you very, very much to my guests, Dr. Khaled, Dawas, and Dr. Nufuz Maslamani, both working for and around the Palestinian cause. Dr. Maslamani currently in Ramallah, Dr. Dawas in London, who's previously been in Gaza and going back very soon. Thank you so much for being with us. We're going to play out with a quick ad, and then we're going to cross to our next guest who is waiting in the wings.